Yep, and then we'll just give it like 2 or 3 minutes for people to start trickling in.
Okay, great.
Alrighty, so it looks like we have a good amount of people. And if you're ready, we can go ahead and begin.
Okay, great.
So, this is Dr. Tina Ho, and she is a plastic surgeon, and she'll be giving a talk on plastic surgery today. So,
Great. Thank you so much for having me. So again, I'm Tina Ho. I'm a facial plastic surgeon in the Philadelphia area. If you're interested in following me, seeing more of my before and after results, and more into glimpse of life as a facial plastic surgeon, my Instagram handle is DRTINAHO, Dr. Tina Ho. Also, you can see more of my work at www.drtinaho.com.
really quick, sorry, your voice is a little muffled.
A little
So,
muffled. Can you
yeah,
hear me a little bit better?
yeah.
Okay. Sorry. So yeah, just mentioned if you want to follow more about me, it's Instagram handle DRTINAHO, Dr. Tina Ho, or my website, www.drtinaho.com. So just to tell you a little bit about myself, I'm a native East Coaster. I grew up in the Philly suburbs, kindergarten through middle school, ended up moving to the DC suburbs in Virginia. I went to William Mary for undergrad and then University of Virginia for medical school. It was there that I, learned about facial plastic surgery. I myself was interested in plastic surgery because of my own childhood reconstructive experiences. I had about 10 surgeries between birth and fourth grade. Had a large nevus, my forehead that needed to be removed, and then had a reconstruction done. So I saw early on the immediate positive impact that my reconstructive surgeon had on me, and I wanted to, provide that similar kind of impact role for other patients. Going into medical school, I knew a good amount about body plastic surgery, like general plastic surgery that focuses on training and being expert with the entire body. And I didn't know really much or anything about ENT, ear, nose, and throat, or otolaryngology until I got to medical school. In my third year rotations, my favorite core rotation was general surgery. And then I had subspecialty rotations on ENT and plastic surgery. Um, Comparing between the two, I felt like with ENT, I really enjoyed the head and neck anatomy. It's so intricate, meticulous. There's all these small vessels and nerves. You have your cranial nerves. It's very delicate surgery. And I appreciated being able to be a head and neck specialist, to have that focus versus plastic surgery. You train in general surgery first, and then you train in that specific niche. Also with ENT, I really identified well with the my mentors there, the residents and attendings. I felt like they were all, really personal, laid back, and smart too, and also had good work-life balance. And then finally, through ENT, there's, sometimes in a surgical subspecialty, even there's different niches within it. Like with ENT, your bread and butter is sinus surgery, tubes and tonsils, other ear surgery, but then you could specialize further. So there's a route to facial plastic surgery through ENT. So I saw with that avenue that I basically committed to applying to ENT residency. So I ended up at the University of Kansas in Kansas City for a 5-year residency in ear, nose, and throat. Really solid, well-rounded clinical program. Never thought I'd end up the Midwest, but I, didn't regret it at all. And then after that, I did a 1-year fellowship in facial plastic and reconstructive surgery in Chicago. Now I'm currently in private practice. My practice is more main focused on the cosmetic side to facial plastic surgery. I do both non-surgical and surgical treatments for facial rejuvenation. And again, this have been really grateful for the journey so far, and happy to be as open as much as possible of that process. So with facial plastic surgery, there's both the reconstructive and cosmetic side to it. So with reconstructive, the spectrum includes facial trauma. Someone breaks their nose or gets in a car accident, breaks their jaw, gets a cut in their face. It can also include scar revision. Also, skin cancer or head and neck cancer reconstruction. So there's something called Mohs reconstruction. A Mohs surgeon is a type of doctor who is trained in dermatology and then specializes to take out skin cancers in pieces under a microscope. So they ultimately can take it in a smaller segment, like leave it behind a smaller defect compared to someone like me. If I take out a skin cancer, I'm going to take a more generous portion because I don't have a microscope. Then, if that surgeon doesn't feel comfortable closing the defect, they will enlist the help of a plastic surgeon or facial plastic surgeon that can close the defect. There's some patients, especially just from my ENT training, who have big head and neck cancers. Say it takes up part of their tongue, their jawbone, that it needs to be removed, and to replace that defect, they need tissue, say from their arm or their leg, that includes skin, soft tissue, even bone, and it gets connected into the defect, linking up local artery and vein. So that's a really complex procedure, but facial plastic surgeons can cover that. Also, from the reconstructive side, facial plastic surgeons can help repair congenital defects or anomalies. I would say, so if you've heard of cleft lip, cleft palate, repair of those conditions are historically done by plastic surgeons, body or general plastic surgeons in the country. But there are some programs or some pockets of the country where ENT trained facial plastic surgeons do that. You can also have microtia repair. If a patient is born with no or part of an ear, they can do the reconstruction for that. So on the cosmetic side, so usually relates to aging face, like for patients who want rejuvenation. Those types of surgical procedures can include facelift, neck lift, brow lift, eyelid surgery, fat transfer. And then I do see a number of younger patients, younger and older patients may be interested in rhinoplasty or septorhinoplasty. Those terms, basically refer to if it's just a rhinoplasty alone to improve the outer appearance of the nose. It's a cosmetic surgery. If someone has breathing issues in their nose, they could undergo a septorhinoplasty, where we do things on the inside of the nose, like a septoplasty, um, help put cartilage grafts to support the nose to improve the breathing. So that's the functional part. And especially as someone who's ENT trained, I understand both form and function. Other procedures like chin augmentation, liposuction of the chin or neck area. And then on the non surgical side, again, this is much more booming. I think patients are more increasingly interested in treatment options, whether they just want to minimize downtime and risk with their procedures. And it's interesting to see or learn that the patient population is increasingly starting younger. It seems like patients as early as millennials are understanding the concept of prejuvenation or trying to do things preventively so that they can look their best and as young as possible. So injectables are a big component of this. So think Botox or other neurotoxin treatments to minimize wrinkles, and filler injectables, which are great to restore volume or definition in the face. I see a lot of patients, and I'll show a case in a little bit, who want to do facial contouring, like do non-surgical treatments to help give more definition and restore more youthful or even a more masculine or feminine appearance to their face. So I guess this is a good segue where I can kind of describe a little bit. So why facial plastic surgery for me, and maybe, if some of you are interested in surgery, to give some advice along the way. To me, in general, one piece of advice that I hope you would take away from this is to consider a career in medicine. Really make sure this is the path for you. I strongly recommend, if you are interested in another type of profession just as much as medicine, to strongly take that into account against medicine. Just because medicine, it's a career decision where it's a lot of time and effort and money invested. There's a lot of work life balance sacrifice. Especially as women physicians too, we face additional barriers, whether it's pay gap barrier, work life balance considerations. I'm a new mom. I have a now 8-month-old son, and it's been tougher. It's rewarding at the same time, but to be a new surgeon mom, I take I have to now take each day, like day by day, and go with the flow more, because my time is not my own. In general, your time is not as much your own as a doctor. So, and I think because it's such a long path, with medicine, I remember when I was going through medical school that I had a lot of peers who took time off who are older than me. And I think the trend is for applicants to be older, going into medical school. So it's okay to take time off. And I highly recommend it, because the training, the years ahead will always be there. I myself, after fellowship, took 5 months off with my husband. We traveled to Europe for 5 weeks, and then we got married and went on a honeymoon before I officially started my first job in Philadelphia. So I was someone who went straight through with my schooling and training, never, took a gap year. And it was great. And I wish I only took more time off, because again, you just don't get that time later with all the training ahead. But if you are, once you're going through medical school, I highly recommend to stay as open minded as possible. Because again, I didn't know much about ENT. It's okay to be interested in one specialty going in. But again, you never know how, once you experience certain specialties, or how medical school shapes you, that you then realize the profession that is for you. It's interesting for me to see too. And I tell others, the specialty you pick is not just because you enjoy that breadth of medicine, but also it could particularly suit certain personality characteristics of yours, which I find interesting. So, there's certain stereotypes like, you're in emergency medicine, you might be a little ADD because you see a variety of everything. In, coming through the ER, you're okay with not, having clinic or rounding. Anesthesiologists are very procedural. Radiologists, you know, they they're very visual, right? And they can stand being in a dark room all day. For me, for surgery, I love being able to have a decisive impact on my patients. That's pretty, immediate and tangible in general. And I like being procedural. I like working with my hands. To me, I feel like surgeons are doers, medicine doctors are thinkers. And then when it comes down to facial plastic surgery, ultimately, besides the things that drew me to ENT, is that I am someone who's very detail oriented and meticulous. I think that goes well with someone who is a plastic surgeon. I really enjoy suturing. From my patient experiences, I've come to appreciate how much a scar can matter to the patient, so that I take that into account a lot. And for me too, even if I'm more in cosmetics now compared to being drawn to the reconstructive side, I think as a female facial plastic surgeon and an Asian female one, I've come to embrace that as an advantage where the majority of my patients are female. And so I try to be someone who's as approachable and relatable as possible, someone that they can identify with because they're trusting their face, with me. And even just a small change is a big deal. I love, the opportunity to be able to have someone come back and they're not only looking good, but they're feeling good. They're looking more confident. They have a great smile on their face. It just really goes a long way. And I get a lot of satisfaction from that. And so if you're someone who's interested in surgery, once you're in medical school, and similar to the medicine versus not medicine comparison, really, if you're set on it, great. But if you like another, especially just as much as surgery, strongly consider it. Because for surgery, the training just is pretty rigorous, where you have to be okay with getting to the hospital earlier, just around, you round quickly, but then you get to the hospital, you get to the operating room, you get to operate all day. And so it's just a different kind of mentality and rigor, and often more predominantly male, kind of, especially, which I was okay with, but it does, have its pluses and minuses there. So just to kind of walk through my practice a bit. As I mentioned, I'm in private practice, but there's, there's different kinds of, possibilities in terms of the life as a plastic surgeon. So as I mentioned, I'm in private practice now. So I'm in clinic, 3 days a week, and then operate 1 to 2 days a week. I do have one admin day on Mondays where I'm an independent contractor. So I myself take care of things like marketing, responding to patient inquiries. That's just on me building my website. So even Instagram, it's something that I run, and it's all me. It takes a lot of time, but it reflects me if I'm more involved. Typical clinic day, could be basically 8 or 9 to 5. I might see, you know, 5, 10 patients or so, maybe up to 20. I don't see that many, but it's okay. Like for me, especially with cosmetics, it is more variable because it's based on what, demand, supply and demand, what patients are willing to pay. At the same time, even though, I would want to help treat patients for medical reasons too, it's more straightforward that I don't have to deal with insurance. And so, from a compensation standpoint, if you're doing well, you have the reputation, you're bringing patients in, then a plus is, the compensation factor is good, especially with elective surgeries and other procedures. So again, I could, on a given day, if I just do one facelift surgery, that is great. I don't necessarily have to put in like a full day, for me to feel productive. Surgery days. So would start at 7:30. I may be done by 3 or 4. It just depends on how many cases. I might just have one case on a day. I might have a couple, or 3 or 4. And again, if you're academics, you could more likely have long days and have bigger reconstructive cases. So, but just to think about, take into consideration too, even if it sounds like I have like a 9 to 5 job, you have to think about time to finish clinic notes, maybe have to call patients. There's always something to do. So again, just to kind of harp on the fact that, really, even once you're in medicine, it's a big time, effort investment. You have to often prioritize your patients above your family. So there's just not set hours. Like someone who, like for instance, my husband, he's not a medical professional, but he can, just clock in. Like he just puts in the hours per week, and we just can't do that as doctors, or unless you just really absolutely do shift work like emergency medicine, or maybe as a hospitalist. It's hard, sometimes with the boundaries. um, and then otherwise in private practice, I don't around the hospital. I don't see patients on weekends unless it's my patient with an issue. I currently don't take ER call, so it's great. So I only take call for my patients. Pluses and minuses to that, where technically I'm always on call for my patients, but with plastic surgery, we rarely have urgent or emergent issues. I would have to find a colleague to cover for me if I were to go on vacation. It's different than, say, if you were in a big group, like say if I was more of an ENT surgeon in a big hospital or academic group. Well, you have to take call. Maybe it could be 1 week a month, or 1 week, every couple of months. And you're actually really on call, and just depends on your volume. But then the other times, the other weeks, of the year, you're actually not on call, which is nice. But again, if your patient happens to have an issue, you may feel, compelled to take care of them, even if you're not on, call. Um, in being in private practice, the pluses are, you have your own autonomy, determine your own hours and call, but at the expense of that, especially with private practice, as I mentioned, just variability, depending on how busy you are, or what income you're bringing in. And then you have to, man, for me, I don't do it because I'm an independent contractor, but think about hiring and firing and really managing your own business. So it kind of comes down to your personality, your ambition, down the road, of how you want to do your practice. If you want to be just in the hospital, if you want to be in private practice, but there's just, various factors, uh, that play into that. So what I'm going to do is I'm going to go over a couple of cases briefly, just mainly going to be a series of before and after pictures. And then after that, I'll open up to questions. I see that we have, I think, a good number of questions here, but just so I can help focus on that, and help answer any questions along the way. Okay. So what I'm going to do is I'm going to share my screen here. Let's see here. Let's see. Sorry, I don't know. Let's see here. Okay. Share. Okay. 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 Can you see this patient? Okay. So this is a surge of, and sorry. Okay. Um, so I'm going to start here first. So this is a lovely patient of mine, and she underwent, upper and lower eyelid surgery, with me. Oh, sorry. She just went upper eyelid surgery with me. This, if we have time, or you can, go on my website. I have videos to actually show a sample procedure, where this procedure can actually be done in the office under local anesthesia, just like going to the dentist. She actually became a reconstructive, patient of mine too. Very unique situation. But if you take a look at her on the left, and you see the heaviness to her eyelids here, as we age, we tend to develop redundancy of skin in certain areas of the face with gravity pulling things down, and then also loss of volume too, and definition. So you can see that she's at heaviness of her upper eyelids, makes her look more tired, appear older, and then just with this, removing of this excess tissue, I basically excise out like an ellipse of tissue on each side. You see her on the right that her eyelids are showing more, and her eyes just look more fresh, more awake, and like they're popping open. And even just with that, the incisions heal really well. You can't obviously tell she had surgery. To me, that's the ultimate compliment for someone to come back and they look great, and their family and friends can tell something, but if they ask, oh, did you go on vacation, get a haircut, they just obviously they can't tell what exactly was done. So when I saw her at 7 weeks out to take out the stitches, she was doing well. And then unfortunately, 2 days later, her dog bit her eyelid. Um, so she suffered, a traumatic dog bite to her eyelid as well as her nose here. And so you can see on the left, this is the her traumatic injuries. Luckily for her eyelid, the lacerations made just reopening her previous wound. It wasn't as if she lost a lot of tissue, which would have made the reconstruction a lot more challenging. So in this case, what I did, and this is what you would do if you saw a trauma patient, in the ER. I cleaned her out really well because you want to minimize infection as much as possible, and then I tried to repair this with stitches. As best I can. You want to close this up sooner than later so that it gives the best chance for healing when it comes to facial trauma. And luckily for her, um, you know, her dog didn't actually get her eye. It could have been a lot worse. I've seen a lot worse. So this here shows her eyelids closed, and again, this is 6 months out on the right. So she is really well healed. She luckily healed beautifully. And if you see on the right, you see these faint scars in the eyes, but they're really faint. So again, the face heals well. The scars are usually minimal with this upper eyelid surgery. And I was overall really happy with um, her healing. And again, to go from the left here to the right is just really impressive. As if you couldn't even tell that she had a dog bite to her left um, upper eyelid. This here is an interval picture. So this is where she was probably a month out after her repair. And a couple of things to point out, and it's something that I learned myself. If you see in the left eye, her eye aperture is smaller compared to the right. We call this a ptosis. Some patients have ptosis at baseline, and it's something where I don't routinely perform because I wasn't formally trained in it. Oculoplastic surgeons who can do eyelid surgery as well definitely have much more extensive training and expertise with performing ptosis repair than me. But this happened because probably of the swelling, the trauma to it. She also, in the inner corner of her eye, developed what we call webbing, a scar band there because of how that area is concave, and just unfortunately where the laceration hit there, it caused the scar to bunch in as it was healing. So there are these two issues that I asked for advice on, and luckily over time, just with massaging and medical management, the ptosis resolved on its own, and the webbing has become much more minimal, that we haven't had to do anything else. We didn't have to do a revision. So I feel really fortunate that she otherwise healed well. And again, this is the right here, her final result, which is again terrific, and it looks very natural. And then let me see. This is just an example. This is before her trauma, but just to kind of an example at 7 days out with the stitches before they're removed. I tell patients they can be black and blue for up to 2 weeks after their eyelid surgery. That's after her trauma repair. And again, let me see. Um, kind of show. So this is in her final result. You can see more lid show. And then there's probably one of the trauma. Again, the before and after. So again, really happy with how she healed regardless. So, okay. And then, so now I have an injectable patient that I can show you here. Okay. Okay, so this patient, she's a fitness instructor. She's in great shape, and she came to me seeking, for some facial rejuvenation with injectable procedures. If you can see on the left, really she doesn't have like significant skin laxity or volume loss. She just doesn't look to age, but to me, she looks a little masculine, like a little harsh. And that if we achieve more definition in certain areas and soften other areas, we could, be able to produce not only a refreshed appearance, but a more feminine appearance. So I don't have the emoting photos, but I did do Botox to the upper third of the face. That kind of helps open the eyes a bit and softens the wrinkle lines. I also placed Botox in her masseter muscle, which is these muscles right here by the posterior jawline. Placing Botox or neurotox injection there can do one of two things. By paralyzing the muscle, it atrophies it, so it helps slim the muscle. It helps to contribute to like the ideal youthful female face, which is one that's like an inverted pyramid appearance, like a V-shaped contour. And then the other thing that it can do is help relieve tension on the TMJ, the temporomandibular joint. So basically relieve TMJ pain from, if you're someone who grinds your teeth a lot, has a lot of tension in your jaw, Botox is a good adjunct treatment to help relieve the tension there. I also placed some filler in the jawline here, filler in the cheeks to give a little bit of a lift. She also felt like her left brow was a little more depressed than the other, so I placed a little. I put a little Botox for a brow lift, plus some filler here to help even out her eyebrows. And you can see over here with everything in combination. It's all subtle refinements that add up to a global improvement where she looks more refreshed. Her eyes are popping out more. Her facial structure looks more feminine. That follows more that V-shaped structure, and she looks softer too, with lift in the right places. And I'm going to go through a couple of pictures here. This you can maybe see up close. See again how bulky are her muscles here, where she had that made her lower face look more square, look more masculine. But bringing it in a little bit helps to taper the lower face and make it more feminine. And then actually, let me go back. So you can see how she had wrinkle lines around her eyes and that they've softened. Again, there's always an extreme. To me, I like to produce conserved natural results. If a patient wants to push it, we can. But if I were to restrict the lines around her eyes even more, that's when she could start to look unnatural if she looks too restricted. And you would see again, just a little softer, fine for just take a little jawline, how that's improved, and the cheeks, have a little bit more definition and lift when you look at these, lateral and oblique views. And that she just looks smoother overall, and especially up from here to here. And we didn't have to do that much. And again, besides her lipstick, she really isn't wearing much makeup at all, so we have some consistency in pictures, and you can see the light hits her cheeks a little more just with a little lift and definition to her cheeks. Okay, great. Okay, so those are a couple cases there. So why don't we, I guess, move on with questions, and then I can always come back and show you the more before and after pictures or some videos if we have some time. So should I just start from the top with a
Yeah,
question?
go ahead.
Okay, so great. Okay, do you ever decline to perform on patients due to concerns you have regarding why they want a surgery or what the results will be? That's a really good question. So yes, part of my, job as a surgeon is to make sure I am operating on the appropriate patients. So colleagues, say my general surgeon colleagues, are those who operate for medical issues. They have to make sure that patients meet certain criteria to qualify. Like for instance, if they need their thyroid removed, is there an indication? Do they have a big mass? Do they have something that's growing larger? And also, are they medically healthy enough to undergo surgery? In my specialty, I have to overcome similar hurdles, but especially when it comes to cosmetic, I want to make sure that the patient has realistic expectations and that I can meet them. So, because if I can't, we have patients that could have body dysmorphic issues. You can, even if you created what seems like a perfect result, if you can't make the patient happy at the end of the day, then you're going to have issues there. So it's something that I'm continuing to learn as a young surgeon, but sometimes saying no is the toughest thing to do as a surgeon, especially when you're eager to operate. I was wondering, how long are plastic surgery residencies? So for general plastic surgery, I believe if you match into like the integrated, I think, or like the one that goes straight into plastic surgery, it does include general surgery training. I think it's 6 years. I think if you do the plastic surgery fellowship after general surgery, it might be 5 plus 3. If you go the ENT route, it's 5 of residency in ENT plus 1 in facial plastic surgery. And to me, that's not that long at all, because if you compare to doing a medicine or pediatrics residency and then subspecializing, that's 3 and 3. So it's pretty comparable. What made you choose to enter in plastic surgery, and do you believe the schedule is flexible? So I mentioned earlier, I had my own childhood reconstructive surgeries where my own surgeon had a early positive immediate impact on me. I wanted to provide that similar type of influence on my patients. In terms of flexible, well, I think because I'm more of outpatient basis, I do have that flexibility. I could, if I wanted to, take vacation tomorrow or next week. But at the same time, if I don't work, then I don't make money. So it's just those considerations. If you're in private practice, you do have more, power over your schedule, and more autonomy. But you have other challenges, like for instance, if you are running your own business and you go on vacation, not only do you not make money, but you also are paying people, to keep the practice running. So you're like in the negative. Makes sense. What are the specialties and subspecialties in plastic surgery? So for so in my realm, facial plastic surgery, so I mentioned, you don't really specialize further in terms of more training, but it's just what niche you decide to do. If you would rather be more reconstructive or cosmetic, or both, and what kind of reconstructive, for instance. So they mentioned there's some programs in the country that do cleft lip, cleft palate, but that's more predominantly uh, general plastic surgery. And if you go the general plastic surgery route, then certain avenues for specialization include hand surgery, craniofacial, so that would be specializing here. You could do an additional aesthetic specialty. You could do breast, like reconstruction, or breast surgery as a main as a subspecialty. How competitive is getting a residency for plastic surgery? So it's general plastic surgery is one of the most competitive subspecialties. That includes dermatology, and ENT is up there as well. I think it's gotten even more competitive since I applied. And I remember the one year, maybe when I was a third or fourth year, it was like the most competitive specialty that year. So it's highly competitive. I am a good example, though. I think if you work hard, you have a passion for it, then you can find your way to getting into the pathway, the career that you desire. I was pretty average in my medical class, but made sure to get enough research done, and along the way, it's what clicked for me, and very grateful to have been able to match into ENT. What was your most challenging case? Let's see here. I can talk about a recent case I just did about a week ago. I had a 25-year-old African-American male interested in septorhinoplasty. Previously had a nasal surgery that he wasn't happy with from a breathing standpoint and a cosmetic standpoint. He broke his nose. So he wanted he has a flat bridge and a rounded tip, and he wanted to augment those. So basically have a higher bridge, more defined tip, and a more projected tip as well. So I ended up harvesting rib cartilage, which is a good source of cartilage. You have a scar there, but to be able to create a graft on top of his nose here, a dorsal graft, so that his bridge is augmented, and also to do other structural grafting to help him breathe better. It was a really long case, but really rewarding. I actually just saw him today, and he's doing pretty well so far. Can surgical dexterity be learned? I'm interested in surgery, but worried about my dexterity. I think so. I think it's something, if you go at it, I think it's hard to say, how early on is someone, does someone have surgeon's hands or not? I think you have to just really enjoy or appreciate working your hands a lot. If you're someone that, you know, doesn't enjoy suturing or can't tie a knot, there might be some basic fundamentals there that you may say, hey, let me reconsider. But, every budding surgeon needs to go through the basics of, this is how you suture, this is how you tie knots. That's, you have to practice, practice, practice. And I think, again, just like with whatever in life or whatever you're passionate about career wise, if you have a passion for it, you put some hard work into it, you can make it possible, make it happen. What do you think is and sorry, I hope it's okay. I think my son has been crying for a while. If it's okay with you guys, I'm going to bring him up here and then I'm going to come back downstairs. I'm going to keep answering questions if that's okay. Okay. So sorry. Okay. So what do you think is the most common misconception about plastic surgery? So I think the barriers are, let me grab him here, are changing. You want me to grab him? Hi. Okay. I'll change hands. Yep. Okay, so we're gonna answer some questions here. Okay, so this is Leo. This is my 8-month-old son now. It's just sometimes it's that time of day and dad's been with him. So, okay, so misconceptions. Well, I think, and hopefully barriers are changing, but we all like to, when it comes to plastic surgery, I think there's a lot of judgment that comes with it. And me too, as a surgeon, where I have to embrace myself, as long as patients have realistic expectations or goals, I shouldn't judge a patient for whatever they want to do for rejuvenation, as long as it's within realistic, as I mentioned, realistic expectations. So I think, with social media and such, social media out there and celebrities, for instance, being open about the procedures they get, I think it's become more normalized, and with younger patients seeking out cosmetic procedures. But at the same time, we have to think about, there is still a sense of judgment there, and in social media where, people are quick to judge or to provide harsh comments and such, that, there's still barriers there, that we have to think about and try to be, in general, be more open to each other, accepting, especially when it comes to plastic surgery. What are some common issues or problems patients come to you with? So from the cosmetic side, a lot of patients, feel like they just look older. They're tired, especially in the age of COVID, being on Zoom meetings and such has, I think, caused a surge of patients wanting to do procedures, especially if they have a downtime and their financial resources are okay. I have a lot of patients who just are bothered by their wrinkle lines. Maybe they lost some volume in their face. One issue that affects younger and older patients that I love treating from a non-surgical standpoint is dark circles around the eyes with hollowing. So you can actually do filler there. That it's a nice improvement to really fill in the volume defect and bring about rejuvenation in the eye area where eyes usually show the earliest signs of aging. in patients. What's the most common procedure you perform? So I would say right now, injectable side, I do a lot of Botox and filler. So a lot of non-surgical rejuvenation. And then on the surgical side, I have this niche for, I guess, jawline contouring. I have a lot of, middle-aged, but also younger patients who want to seek more rejuvenation, especially in their lower face, to get more definition. So liposuction, where you place an incision here and you can reduce the fat here, this will help give more contouring, increase definition to the jawline. Do you feel that you're able to build relationships with patients with the frequency that you see them? So I actually am fortunate with my patient relationships. I would still say it's more superficial compared to, say, if you're an internal medicine doctor, primary care doctor, where you see your patients for their annual visits. Maybe they have or your OB-GYN, they have a kid, and then you follow their child too. You see them for long-term issues. For me, it's like, okay, I might see a Botox patient every 3 months, or a filler patient every 6 months, or I see a surgical patient who I keep seeing for follow-up, and then they do other treatments with me. But at the same time, I'm still able to establish a rapport with them. I like writing notes and jotting little notes down in the chart to say, oh, like, did they go on a recent trip? Do they have these kids age so and so? What do they do for a living? So that then I can ask them about these things. And it's nice, have that connection and to know your patients on a personal level. As a plastic surgeon, are there any other specialists that you interact with in surgeries? If so, which ones and why? So again, this is more likely in academic practice, where you have more complex cases where you can, that you can collaborate together. I would say, so let's say in private practice, I haven't yet, but I could be doing a surgery with another surgeon who, say, the patient wants breast surgery too, that we could do surgery at the same time, or tag team. Or if I have an oculoplastic surgeon colleague where they are doing the eyelid surgery part and I do the facelift on a patient at the same time. In the academic setting, for instance, say if I was doing head and neck cancer defect reconstruction, well, you'd have the head and neck cancer oncology surgeon come in and take out the cancer first. We a lot of times, might have, let me think, what else that there might be. So there's definitely opportunities for collaboration, but I think more so in academics. Okay. So I feel like plastic surgery is often viewed negatively by the general population. What is something you wish more people understood about plastic surgery? So I think this is a great question too. I basically alluded, to the barriers we still face, but I think plastic surgery is becoming more normalized. I think, I think in terms of the goals of plastic surgery or aesthetic treatments, it all comes down to the patient's goals, the provider's goals. But if you see someone like me whose goals are to, create beautiful natural results that are conservative, and I think, people should be allowed to have the opportunity, if they want to seek facial rejuvenation, more harmony, more balance in their face, that's an appropriate reason or goal to have. I think we should try to be more open, understanding. You can't really relate with someone else as much unless you're in their shoes or know them really well. And I think it would be ideal for everyone to understand too. Like, I think plastic surgery or cosmetic treatments are more commonplace than we think. Like, I like to tell some of my patients, like, if we could survey all the people out there on the street, I mean, not those of you watching, since you're all pretty young, but those who've had Botox, I think we would all be surprised of who has had Botox or hasn't, that it's that prevalent. Were you interested in any other surgery, especially before choosing plastics? So I always was interested in general plastic surgery at first. I mean, I did like general surgery was my favorite core rotation. I would say having interned in it, I don't think that would have been my backup choice, but I did like that, the best. I felt like I would have been surgical otherwise. I was really surprised how much I liked OB-GYN. I rotated on it first and thought I was going to write it off, but I was surprised how much I really enjoyed it. How do you handle conversations with patients who have body dysmorphia? So that's another good question. So basically, for me, I need to gauge a sense of, okay, are their expectations and goals aligning with mine, right? Or what I can do. You want to say something, Leo? Okay. So, and then you see too, if they, whether they're realistic or not, and if they seem very fixated, on themselves. I think too, especially if it's a surgical consult, I ask my surgical coordinator to kind of screen them too. When they follow up, they talk about the fee quote and everything, because it's always good to have someone else, right? You might just be in the zone. I might really want to operate on this patient, but again, I have to make sure that I'm still doing good by the patient, and especially in their eyes. So, how has COVID affected surgeries in your practice? So that's a good question. I think there's two spectrums to it. I was on maternity leave when we had the shutdown, so it was really good timing. But I think there's been a surge in non-surgical and surgical, again, amongst those patients who probably are doing Zoom meetings, seeing themselves, more that they're not happy with how they're looking, and if they can afford the downtime now more, with working from home, that they're more interested in getting something done sooner. So I've had patients who've come to me that said, I want to get surgery done as soon as next week. While at the same time, there have been times where it's been slower, where I think, if patients are apprehensive from a safety standpoint, health safety, as well as whether they have the finances. I've had some patients who've had to scale back based on finances, that they're not able to do as much as they would otherwise want to do. I was wondering, how do you find the competitiveness of ENTs? So it's very competitive. As I mentioned earlier, it's probably much more competitive than when I applied. But again, if you're someone who spends the time, your home program, sees a click in you too, and you really just need to match it one program. And if you work hard and do all the right steps, then I think it's possible. But you do have to consider, when you apply for a competitive surgical subspecialty, whether it's plastic surgery or ENT, you have to have a backup. You have to have a backup option or backup plan, basically, which is hard. I still don't know to this day if it would have been a year of research or general surgery intern year. But I definitely would have applied to ENT again one more time, and then thought about what my option would have been on that basically gap year. Let me have him go over to my husband here and finish up his questions. Okay, so let's see here. What do you think is most challenging to be a plastic surgeon? You want to grab him? Okay. So what is most challenging to be a plastic surgeon? I think one challenge for me, especially as a young surgeon, is in private practice, doing a lot of cosmetics, is figuring out like my brand, who I want to be, establishing confidence and rapport with my patients. It's just very different because plastic surgery is very client oriented, especially in the private practice cosmetic world. It's different than if you start, a job as a hospitalist or primary care. Yes, you also have to develop skills like confidence and patient relationships, but it's very different. Like you have to be, in a way, there's a sale to it. And especially as someone, when you look young, you are young, inexperience is a factor too, when patients are often older than you and you need to convince them to do procedures. How has the pandemic affected your schedule in regards to elective surgeries? I think I mentioned that earlier. So, it's more unpredictable, but it's always unpredictable. And again, just sometimes it's been slower. And then I've had patients again who said they want to get surgery done within 1 to 2 weeks. As a plastic surgeon, you sometimes have to deal with tumor removal. Not currently in my practice, but yes, in my training, especially if you're more on the reconstructive side, you can be involved in taking out the tumor or cancer. I do take out benign lesions like moles and such, lipomas. I can do that, in the office, as long as they're more on the superficial side. How do you manage work-life balance in your current practice? So that's something I'm still trying to figure out. I would say my work-life balance is better since being out of training, but it's different. Like to my husband, he would say I work all the time because there's always something to do. As I mentioned, marketing, my Instagram, work on my website, uh, might have to, take patient calls, and then trying to figure out as a new mom, on the side where my time isn't my own anymore. But I know I need to work on trying to prioritize when I can, like self care and time with family. But it's definitely better, than being in training. And the thing that makes it hard too is I love what I do. So I feel like at the end of the day, and especially do not go into medicine for money. If you love what you do, it doesn't, like that cliched quote, it doesn't feel like work at all. Um, do you work with a lot of tongue or throat reconstructions for cancer patients? So definitely was exposed to that in my training in ENT. That requires, if you want to do that kind of reconstruction, either become a head and neck oncology surgeon or a facial plastic reconstructive surgeon too. But it's through ENT or from the general plastic surgery route. If you want to be that kind of reconstructive surgeon, you can do that as well. What is the main skill you use on a day-to-day basis? So a lot of my day-to-day, like in the clinic, I do a lot of injectables. So injecting with precision using cannulas and needles, I would say, is a main skill that I use often. Are there any medical emergencies in plastic surgery? Medical emergency plastic mainly are tied to if you have an emergency associated with your own patient. Like you could have a hematoma, a seroma, like a blood fluid collection. If it's something that's just like, say, from a facelift, focal here, you want it to evacuate it because you don't want to affect the healing and have a nidus for an infection. It's something, if you see it, you could drain it in the clinic. But say if it's because there's a big artery bleeder that you didn't control, or has on expose itself, and then it's a big expanding hematoma, this could become like an airway risk, right? Like can push on the airway, can have really bad bleeding that might need to take the patient back to the operating room. Other medical emergencies, say if you came through the ER besides surgery complications, more in the plastic surgery realm, someone who has a burn, that needs to be cared for, someone who, has, say, hand trauma, like they get frostbite or they accidentally cut off their finger, or some facial trauma that you just need to repair, like the laceration, a gunshot wound, need to attend to. Sometimes with broken bones, you don't necessarily need to do it in the middle of the night. You could wait a little bit on that. Does going into more specialized fields like trauma reconstruction require more classroom time? Or is it more hands-on, like a fellowship? So anything that you want to specialize more in, probably need more fellowship or hands-on training. You could, figure it out. Say if you are someone who was a body plastic surgeon and you feel like you want to do a lot of rhinoplasty. If do good with those surgeries and develop a niche for yourself, you can do it. Like I, for instance, the other day, buccal fat removal is a very niche kind of Instagram popular procedure now. You remove fat right here in these part of cheeks for patients with full cheeks, and you help contour their face more. I would say I've never seen or done it, but I talked to some colleagues who've done it. I mean, luckily it wasn't like doing a neck lift or facelift, something much more complicated that I would feel like I need to do, and actually train in. But this, knowing the anatomy, that I did on my own, the surgery for the first time. Let's see here. How do you deal with potential burnout that some physicians can face these days? I would say, I wouldn't say I've suffered, significant or true burnout yet, but I think it's important to stay balanced, seek time for self care, which I did in residency. I would say I wasn't the best studier, that who studied all the time, and also too to have the best support system. I'm really lucky to have my husband who can work from home, take care of um, our baby at the same time, especially in the COVID era. And but again, having a strong support system, you know, through your training and such, I think is really important. Finding your outlet. Are you ever nervous going into your surgeries and procedures? Of course. So um, you want to make sure it goes well. And I think that's a good sense. If you are nervous or, you have a little adrenaline going, it's, it's part of the rush because you enjoy the procedures and, or you want to do well for your patient. Um, what stuck to you about plastic surgery. I think it all goes back to just having, that immediate impact on my patients, that positive immediate impact and very tangible, that has just stayed with me throughout these years. Um, let's see here. I don't do much trauma work. It's only if, a patient calls in and they have like a cut to their face or broken bones that I can further evaluate and see if they need surgery at some point. When would you say you knew you wanted to go into plastic surgery? Early on from childhood. What is the line between facial ENT surgery and maxillofacial surgery? That's a good question. So maxillofacial surgery, they are oral surgeons. So they do dental school first and then they do surgical residency training, but they are specialists in the mouth first. There's a lot of where ENT, ear, nose, and throat covers a lot of it. It's a lot of overlap. So I would say from my perspective, I don't routinely take out teeth or deal with the teeth. I don't do mid face or jaw advancement or other kind of technical procedures. I could if I had, and it wasn't included in my training. Um, like temporal mandibular joint procedures. I don't do. Some overlap between the two subspecialties. We both cover facial trauma. I had in my residency. So depending on when, which specialty service was on call or were they covered for, there's overlap. Tracheostomies, they, both of us do that as well. Has the advances in technology, especially those in medicine, affected the way you perform procedures? I think the fact that there's more and more non-surgical treatment options has really shaped how, that is such a popular treatment option now that it's not necessarily just surgery. Um, I do perform more reconstructive or cosmetic. It's a mix of both, but much heavier on cosmetic right now. Typical day at work like for you, I think I mentioned it before, like so mentioned an OR day, 7:30 to 3 or 4. Clinic day, like 8 to 5. And the kind of patients I see are surgical or non-surgical consults, in-office procedures that include like Botox and filler, usually. Um, let's see. I think I answered that question before, and then COVID answered that. What are some trends that you see with patients seeking cosmetic procedure? I touched on that a bit, but seeing younger and younger patients, I'm pleasantly surprised. And facial contouring is become a bit of a niche in my practice, especially among younger patients that they want to look more defined, and either in a more feminine or masculine way. And we can achieve that with Botox and filler. Let's see here. I talked about work-life balance earlier. Do plastic surgeons work closely with PAs and nurses? It depends. They can. So they can work with them in the operating room or they can assist with the surgery. Some surgeons, again, I'm an independent contractor, so I don't own my own practice yet. Have PAs or nurses that work in the clinic with them that do injectables or assist on their surgical patients. So, for me, I actually learn from PAs and NPs in my fellowship, so I value them as well. I think we're all peers. There's, non physician injectors out there, and I would, rate them to be just as credible and experienced as long as they have dedicated training in facial anatomy and can handle possible complications with injectable procedures. can you talk a little about your residency journey and training? I think based on timing, don't have as much time, but I'm happy to help answer that. I can give my Instagram handle and email address here. Talked about work-life balance. Nope, no call nights, no inpatients. How do you recommend preparing for competitiveness of medical school? Um, I would say just be ready to study, so if that means taking time off before, as I mentioned, students are increasingly older going to med school. I think it's not a bad thing. I actually think it's good to be focused. For me, I went straight through, but sometimes I wish maybe if I had more of that maturity, would I've done better in medical school. Um, let's see here. So what are your thoughts on time? Do you want me to keep going, or these are all like really great questions, but I guess we just have like a long.
You can go on for like about 5 more minutes and then we can just call it then.
Okay. Sounds good. What kind of medical experience did you have before going to medical school? I volunteered at an ER, like triage in high school. I also interned for a general plastic surgeon, basically worked like her front desk, and got to observe surgeries. I also observed surgeries in general, and I went on some medical mission trips in college, which I highly recommend. I think a lot of students go on these kind of experiences now. It was more of a novelty when I went through, but I think going on a medical mission trip or just traveling in general really broadens your outlook, your perspective, especially for me, I feel like as an American, to really appreciate more like where you're from, what you have, and have that perspective. Major differences between private practice and public hospitals. So, I think I touched on this a little bit. If you're in private practice, you have your own autonomy, you set your own hours, but then you have to hire and fire, you deal with, your own overhead. And it's much more of a cost to you if you go on vacation. If you work for a hospital system, you're an employee, so you definitely have much less autonomy. You might have to work certain hours, certain shifts, take certain call schedule, be at their demand of what patients you see. But then a lot of times when you're home, you're home. Like you have less stress or things that you deal with outside of patient clinic hours, compared to private practice. Private practice, you always have the opportunity to make more in terms of compensation. Did you always know you want to be a physician? I think so, particularly a surgeon. What did you do in college that best prepared you for medical school? Um, I think for me, I think I might have mentioned it before. I think I also got to study abroad too. I think doing what you enjoy, like your passion, whether it's I majored in neuroscience and international relations. It's okay. It's always easier to major in a science, but if you can pick something that's non-science, do it. You only go through college once. So whether it's your extracurriculars or what you're interested in academically, pursue what most interests you, because ultimately once you enter medical school and your training, it becomes a very narrow-minded track, that it's hard to be able to, follow through these other pursuits as much. Um, what about your background do you think makes you good at your job and allows you to enjoy your job? I'm someone who's very driven. I work hard. I'm passionate. I'm also detail oriented. So I enjoy what I do as a plastic surgeon. End of the day, I think I found what really fits me, and something with, and I enjoy working hard. So as I mentioned before, I work too much right now. So it's one of the things, it doesn't feel like work to me. Like there's always something to do. Yes, in reality, there's a fine line to that I'm working on. But I really enjoy what I do. Um, has there been a time that you had to deal with patients that appear to have a plastic surgery addiction, or someone who's not comfortable with their body to the point where they want to change? Yes. And again, I think I answered this a little bit before. I've learned sometimes you have to say no, whether like, because I've been burned a couple of times where I think, oh, if I do a little injectable there, I think they came all the way to see me. I still want to help them. But no, if they don't have realistic expectations, you can do more harm than help, because even if you did it great, they might not be happy. Um, you try to take as much time as you can, to counsel them and be there for them. But at the end of the day, especially if some of these patients are needy, that you might have to back away and say, no. And one good phrase I learned was, to put it on me and say, I don't have the skills, to give you the results that you're seeking. So, um, let's see here. Favorite procedure to do. One of the hardest cases. So I mentioned a tough case. So rhinoplasty, even though that was a really challenging case, I really like rhinoplasty. It's one of the most difficult types of surgery in plastic surgery. It involves both a mathematical basis and artistic intuition, creativity. A millimeter change can make a big difference. To me, the goal of rhinoplasty is to create a more aesthetically pleasing nose, but that's not as noticeable. That's more in harmony and in proportion with the rest of the face. And it's such a detail oriented procedure. It's so humbling, but I enjoy it a lot. Um, let's see here. So who covers for you? I have surgeon colleagues that I will ask to cover them there, and they have their own practices. Um, let's see here. So I think we're at 6:10 now. So what do you think? Do you think this is a good stopping point? Man, I know these are like all great questions.
Yeah, I think this should be a good stopping point. There's a lot of questions, so that's fine. And if you have any questions, you can always like DM her or ask her through Instagram,
Right.
right?
Yep.
So
So here's my Instagram handle that uh, I'll type here, and if kind of more pre-med questions, this is my email address. So feel free to email me as well. So again, sorry for the interruption earlier with my son. It's just sometimes that time of the day. But
like,
again, really
totally
appreciate everyone's time. This is great, participation, really great questions. So,
fine.
and
Thank
thanks for
you.
having me. And I'm happy, like, if we ever just want to do another Q&A session and save some of this, I'm happy to do another session at
For
some point.
sure. Thank you so much for your time and talking about plastic surgery. It was a really interesting talk. And yeah, we really enjoyed it. But yeah, thank you so much.